Hello, today is Thursday, July 9th, 2020. I'm Sandy Griffin-Bukowski, Executive Director here at the Cypress of Hilton Head. Wanted to provide another update regarding our COVID-19 practices as well as an update on our hurricane plan. Thank you to all of you who have already filled out your hurricane form and submitted it, letting us know if you're going to evacuate with us or if you're going to evacuate on your own, and also if you have a pet. That information is vitally important to us as we plan for hurricane season. I've had a few questions regarding hurricane season. First and foremost, our current contract that we have with our bus company is still valid at this particular point. Our contract runs from 1 year to the next year, and so we're still within our time frame with our current contract, and we'll be executing a new agreement. We've been in touch with our medical providers who will be providing ambulances and wheelchair vans for us as well, and they're on notice to assist us during our evacuation. We're still trying to come up with our formal plans as to what we will be doing with evacuation. In talking with our bus company, there is no federal regulation that says that there needs to be 6 feet of distance from one person to the other on the bus. That will really come down to our preference. And I think my last update I shared, we would need quite a lot of buses, about 33 buses compared to our normal 8. So we're still evaluating that plan of what we're going to have to do in that situation. And it may be that some of you decide to drive yourselves to the Heritage International Ministries as opposed to taking a seat on the bus, which would be helpful as well. As far as the ambulances, and wheelchair vans, we will be following the medical protocol for COVID-19 with that. Fortunately, we do not have any positive cases in our Preston Health Center, so we should be fine with that. We also are trying to decide if it makes better sense to maybe take the Preston Health Center residents with us to the Heritage International Ministries as opposed to going to Rolling Green Village. The only reason that we're considering that is Rolling Green Village is in a hot spot in Greenville. We know that there is positive cases in that particular area, and we've not had any in our health center, so maybe we should look at doing something a little bit different there. And we are trying to figure out what is the best direction for us at this point. Meantime, plans are in place for us to go to Rolling Green Village. Documents are all in order, and the Preston Health Center team is working on the mobility and the transportation list of how people would need to be transported from our Preston Health Center. So things are moving along. It's just pretty variable as to what we're actually going to be required to do. South Carolina Leading Age is working with DHEC and the governor as to if there's going to be any other allocations or thoughts regarding hurricane season and the evacuation process. We know that the DHEC governs our Preston Health Center and needs to be evacuated. On the independent living side, we have in the past years evacuated the independent living members with us. There's not a regulation for that, that's just been our practice. So the thought is, do we need to look at that differently? Last year was the first year that the Preston Health Center went before us, and then the independent living residents evacuated after that. Same thing with returning. Independent living residents came back first, then the Preston Health Center residents came back the next day. So we're still trying to evaluate all these options, but more to come within the next 2 weeks as we kind of finalize these plans. As far as COVID-19, I did share a email and a phone blast with you at the beginning of this week that we had our first member positive case here at the Cypress. Getting many questions regarding that, and as we have said before, we really can't divulge for HIPAA reasons as to who that person is. People want to know if it's someone in a building, or if they're in their individual home. All I can tell you is that the person is quarantining in their residence. They have a mild case of COVID-19. We are taking all the precautions of who may have been exposed to this person, and if you have, you've been notified, and we are working through the testing process for that and the quarantining process for this particular case. We also last week had a positive employee case that I shared with all of you before the 4th of July. We are in that process of working on getting the testing results for our employees. Our expectation is that our employees and our members, if they are testing positive or been exposed, need 2 negative tests in order to be able to be considered clear of COVID-19. And so we're working through that process. The labs that we're using are very, very busy at this particular time. We normally would get test results within 48 to 72 hours. What we're being told now, it's going to take a week to 7 days to get some of those results because there's so many tests that are going on at this point. I think the other thing that we have realized since July 4th is every day someone else comes in as they're going through their screening form, whether it's an employee or a member that we're talking with. They do tell us that they may have come in contact with someone who has been positive with COVID-19. And the only thing that I can really stress is that it is so, so important for our members and our employees to continue to wear their face covering. Their face covering needs to cover their nose and their mouth, and there does need to be social distancing within any interactions between members, employees, and others. Sometimes we think that when we're with family members or we're with church friends that, it's not necessary to wear a mask or it's not necessary to have social distancing, but it is. I really have to impress upon you that 50% of COVID-19 could be minimized if people were maintaining social distancing of 6 feet and wearing face coverings. And remember, the face covering needs to cover your mouth and your nose. It really is not good around your neck. And so that was one of the things we learned as we did our contact tracing, that people have masks on, but it's around their neck, and that really is not going to be helpful for us. We're in a new stage with COVID-19. The number of cases are continuing to rise. We are in this for the long haul. We don't know how long we're going to continue in these particular phases, but we are trying to advance as much as we can, but really need everyone to practice the core principles. Wearing a face covering, social distancing, avoiding crowds. If you are in a crowd or group setting, it needs to be 10 or less, and you need to be using hand sanitizer very frequently and washing your hands. If you're sick, please stay home. Don't interact with others. I mean, that is really, really important. As we continue to talk about COVID-19, there are many questions as to what does quarantine mean? Does that mean I can get my mail? I can't get my mail. I can take my trash? I can't take my trash. We are working on some documents that we will be submitting out to all of you so that you would understand what the parameters are when you are in quarantine and what constitutes you being in quarantine. We talked about big Q and little q. I think it's just going to be simpler if we let you know if there's been a situation that you've possibly been exposed to or that we feel needs to be quarantined, that we can give you that document with a start date and an end date of what that actually means for quarantine and what you should be doing or not doing during that particular time. We are working with our Health and Safety Committee on that. We just finished our meeting with them today and really feel that we need to continue to educate everyone as best we can regarding the safety precautions that need to be taken. Here at the Cypress this week, we also started individual family visits with our independent living residents. Today was our second day for that, and they've gone extremely well. Members are very excited to be able to see their loved ones and to be able to visit with them. Today was a beautiful day. We had some people outside on the patio visiting and enjoying each other's company. That will be continuing going forward on Tuesdays, Thursdays, and Saturdays from 1 to 4. Depending on the amount of people who want to participate, we're looking at expanding those hours. Next week, we will start the individual Cypress member visits over in the Preston Health Center with the window visits, and then looking to expand that to people who have loved ones that do not live here on the Cypress campus to be able to visit their members in the Preston Health Center. So more things coming as we continue to work through our reopening strategy, but we just really can't forget the basics of what we need to be doing. As we continue to go forward, I will provide you more additional updates and phone blasts. If you have additional questions, please don't hesitate to submit them by putting them into the internal mailbox outside the Cypress Clubhouse, and I'd be more than happy to answer any of those questions. Feel free to reach out to any of the department manager team to answer any questions, and we thank you. And thank you again for all your patience, understanding, and support as we continue through this pandemic here at the Cypress of Hilton Head.